The following is from a review by Mark Lilla in the New York Times called The Great Disconnect of a book titled I Am the Change. Once upon a time there was a radical president who tried to remake American society through government action. In his first term he created a vast network of federal grants to state and local governments for social programs that cost billions. He set up an imposing agency to regulate air and water emissions, namely the EPA, and another to regulate workers' health and safety, namely OSHA. Had Congress not stood in his way, he would have gone much further. He tried to establish a guaranteed minimum income for all working families and, to top it off, proposed a national health plan that would have provided government insurance for low-income families, required employers to cover all their workers, and set standards for private insurance. Ted Kennedy managed to get it derailed. Unfortunately, thankfully for the country, his second term was cut short and his collectivist dreams were never realized. His name was Richard Nixon. Whenever conservatives talk to me about Barack Obama, I always feel quite certain that they mean something else. But what exactly? The anger, the suspicion, the freestyle fantasizing have no perceptible object in the space-time continuum that centrist Democrats like me inhabit. What are we missing? Seen from our perspective, the country elected a moderate and cautious straight shooter committed to getting things right and giving the United States itself soft-respect back after the Bush-Cheney years.
How many lies and scandals does it take for people to realize what's going on? How many companies, jobs and money do we need to lose? How high do your gas and your electric bills need to go? I go crazy just listening to the excuses they give Obama. He has failed and he has lied. End of story. They say they don't like Romney's plan, but Obama has no plan. He has said nothing about how he is going to change this situation. Obama has spent hundreds of millions of dollars to bash Romney, not to talk about his record. Obama has been repeating the same song and dance for the last 4 years.
Don't forget, just 14 short years ago, we ran a surplus, without cutting Social Security or Medicare. I'm an optimist. It was a recession, not Armageddon, and the economy is recovering, as indicated by multiple positive reports over the last few months, including September's better-than-expected report on new housing starts.
It's been 4 years. Of course it's getting better. This is America. We will make it work. But this president is not helping. All he does is blame somebody else. The overall economy grew at an annual rate of 1.3% in the spring, down from its previous estimate of 1.7% growth, according to the Commerce Department's third revision of second quarter GDP growth. That's the lowest in 4 years. You all need to rent on video, 2016. It is not the fact that he is half black. It is his upbringing by a mother who hated America. And with a straight face you are going to tell me he has America's best interest at heart? Really?
Sometimes the conservatives are the radicals. Is anyone under 55 years of age content to put Medicare up for grabs as a voucher or, if you prefer, premium support system rather than a defined benefit medical coverage program? This especially when the key design element of the change is to reduce the cost of the program rather than to ensure better medical coverage. This is a monumental change. Likewise, raising the eligibility for Medicare and Social Security to 67 are quite radical. Those ages are fine for that portion of the population that is healthy and employed at 65, but for those who are not, there is a good chance that they will have paid into those programs their entire working life only to get no benefit. There was a recent article in the New York Times indicating that for poor white men the average life expectancy had slipped below 65 years of age.
Your choice. Raise the age or have nothing in 10 years. And since I might be labeled a radical conservative, I have one thought, which I keep reading. Psalms 109.8.
The reference to that psalm by conservatives is either not to the point or is provocative. The position you express on Medicare is easy for us to say, since we are not in the under 55ers group, but I would prefer to make the current system solvent for my daughter and the generations to come.
A change is needed. It will not change, but just 4 more years the same.
I think that what I am suggesting in the case of Medicare and Social Security is that incremental change is preferable to radical change. If you recall, I was just voicing a word of caution to the under 55ers, namely, think carefully whether you want to let your possibly negative feelings for one individual or several jeopardize your late-life retirement and medical care. That is a calculation that is open in this election. One can say that Medicaid and Social Security will never be touched, but the House of Representatives has voted to pass laws that fundamentally change their nature, not once but twice, 2011 and 2012, and has insisted that the Senate bring those bills up for an up or down vote. The economy will recover, our peevish likes and dislikes will come and go, but ask any senior citizen whether they would want to grow old without Medicare and Social Security, and I do not think you will find many that would. If you really think that Romney-Ryan would not gut those programs, you have the option to toss that ball in the air. Around 1951 to 1952, my maternal grandfather was dying in his bed of stomach cancer. He was not in the hospital, he was beyond hospital care. I was young and do not know what steps they had taken to make him comfortable. At that time, Dr. Groff was our family physician. He made house calls and you paid out of pocket for most medical care and prescription drugs. People did not talk about cancer, and if you had it and it did not show, it was likely that you would not be told by your doctor or your family. Better not to know was the watchword, I think, since there was no treatment anyway. Breast cancer, among most other cancers, was considered a death sentence. It was only after World War II that medical insurance through employers became a common practice. Before that, medical care depended on your ability to pay or the hospital's capacity for charity cases. There were no for-profit hospitals, none. FDR had put wage and price controls in place in order to keep inflation down and the cost of labor down during World War II. Companies looking to attract the best workers looked for things to offer in place of higher wages. They found that they could offer pensions and health insurance and that these were not covered under the wage and price controls. This was the start of the healthcare industry in the U.S. At the time, the union movement was still strong, especially in the Northeast and in the Midwest, the big industrial powerhouses of the American economy. The unions made it a top priority to get medical coverage for their workers. After a few years, a significant percentage of American workers and their families in the northern U.S. were covered by some form of medical insurance, mostly for hospital stays and major illnesses. However, once those workers retired, they typically found themselves without medical insurance. At the same time, the infusion of money into healthcare that came with the advent of company-sponsored insurance plans began a revolution in healthcare, where cures began to become available for formerly incurable illnesses. Hospitals were upgraded with new equipment and treatment became correspondingly more expensive. Doctors stopped making house calls. Doctors began to take specialty training. Mr. Barclay was a retired auto worker from Detroit, who in 1959 testified before the Senate Subcommittee on Problems of the Aged and Aging. That year, the subcommittee held a series of hearings around the country to better understand the financial problems facing the elderly. Medicare didn't exist at this time, and Barclay, speaking on December 10, used his appearance to highlight, among other things, the difficulty he and fellow seniors faced paying for medical care. He said, "We retired workers are very proud of being citizens of the greatest country in the world, but we cannot think it is the greatest possible country when about 65% of the aged do not have any insurance to deal with their needs for hospitalization and medical care. Without such insurance, The retired person must pretty much exhaust any savings he has before he can get free hospitalization. This is a constant source of worry. Many of my acquaintances will not visit a doctor for minor illness because they have no money to pay for drugs. After they exhaust their savings, they go on welfare to get medical aid, but then, in many cases, it is too late. Barclay's testimony was consistent with statistics of the time, which showed that about 2/3 of retirees had no health insurance at all, and even those with insurance frequently had insurance that covered only a small fraction of their costs. The biggest fears included not being able to pay for care and risking turning to children or siblings for help, or it meant relying on the charitable attitude of the doctor or hospital. Most profoundly, it was the sense that illness or injury, bad enough themselves, could be disastrous for family finances unless you were lucky enough to have retiree coverage from a union or government plan.
So what is your point?
My point is that those under 55 years of age should consider carefully whether they want to put these programs at risk. The Romney-Ryan campaign was not forced to put these issues on the table for this election, but since they chose to, the voters should be aware that they intend to change Medicare in this very fundamental way.